Health for Life. This is the first ever medical show on television that deals with prevalent health problems and concerns, and they do so in an easy to listen to question and answer format. To find out what we're discussing today and to introduce us to the visiting specialists, here is the producer and the host of Health for Life, Dr. Surendra Prasad.
Good afternoon, viewers, and welcome back to the second half of the talk today we're having on fever in children. I welcome Dr. Jabour back in the studio, and this is the segment where we're going to deal with your questions. Dr. Jabour, welcome back to the second half of the program.
Thank you, Dr.
Good
Prasad.
afternoon. Now, I've seen the first question which has come in from Ms. Singh from South, and it deals with a very common question that myself as a parent, and I'm sure many parents have asked you. Does a fever in a child cause seizures?
As I said earlier on in the program, that seizures is just a symptom, just the way fever is. And there are many causes of seizures. Now, we have to differentiate between the simple causes of seizures that children get, which are what we call febrile seizures, and these are associated with fevers in about 30% of cases of children. Not every child who gets a fever is going to get a seizure. Okay? So you tend to have a predisposition towards it. Sometimes there's a family history of it. And there may be some underlying causes such as prematurity, etc., or a brain that has not developed as well as it should. And so you can then get fevers that are associated, seizures that are associated with fevers. A lot of times people get confused with the word seizure and fit. They're interchangeable. Okay? So just keep in mind when you're talking fits, you're talking seizures. Okay? And so for the febrile type seizure, that in children, if it's the pure, and we have specific criteria for these type of seizures, okay, which are called febrile seizures, as to distinguish it from the more serious type of seizure, which are not associated with fever, and which you will see in conditions like epilepsy, brain tumors, etc. Okay.
Now, before we get to the next question, one of the things when we're talking about febrile seizures, and as you mentioned in the first half of the program, the tepid sponge. And I find that many parents get confused about the temperature. Could you tell us again and tell our viewers how they gauge what is the right temperature for this sponging?
The major thing I try to get across to parents is to look at your child. The child is going to survive. Nature, God has set him up to survive. Humanity's species is supposed to go on. And so there are mechanisms in place to help him. And so he will utilize these mechanisms. And he will tell you, he will communicate with you that, you know, the nature is doing what it's supposed to do. And so I use that as, in my judgment, in terms of when I look at a child, and when I walk into my examining room and I look at the child and I look at the parent, within a few seconds I know, one, I've got to treat this child is very sick, or no, this child is fine, I've got to treat the parents. And so the body language is what tells me a lot. Okay. And so when I have a child now that is sick and needs his fever lowered, the parent has got to look at the child and see how the child is behaving. If the child is ignoring the fever, you ignore the fever. Give nature a chance. If he's clingy, cloaky, etc., then you need to step in. And that's where things like tepid sponging come in. And you've got to understand the mechanism that what you're doing. It's physics now. You need to lower the temperature, and one of the major ways that you take heat away from any body, that it's human or inorganic, a stone, a rock, etc., is to allow water to evaporate off. Okay. When it evaporates off, it takes heat to evaporate it. So when you allow the water to evaporate off of his body, it takes the heat away from his body, and that lowers his temperature. And so you want the water to evaporate off at a temperature which does not make him shiver. Okay. If he's shivering, you're defeating the purpose of what you're doing. It means now, when you shiver, you generate heat. Your muscles are contracting rapidly. And when muscles contract rapidly, you generate heat. When you run, you sweat. Okay? And so what you want out of the water to do is be at a temperature that doesn't allow him to shiver, and for the water to be able to evaporate. Let him play in the water. throw it in this, why we call it sponging, because you'd use a sponge, soaks up the water, you put it on nice, cool, comfortable temperature for him, and as the water evaporates off, his temperature is going to go down. Give him a rubber duck, give him something inside the water floating, and it'll allow him to stay in the water for a while until you bring the temperature down. The major portion that you've got to concentrate on, though, if the fever is very high and it looks like he's going to have a fit, I mean, you can see him irritable, jittery, jumpy, then that type of thing, you want his head cooled.
Cooled. Okay.